This is Dr. Eric Miller. Welcome to Bio-Guided Music Therapy. Welcome to Music Therapy Online. This tutorial introduces fundamental concepts of bio-guided music therapy. Our focus is on utilizing real-time, physiological, data-driven music therapy for stress, anxiety, hypertension, ADHD, Raynaud's disease, and other disorders. In this class, participants gain introductory knowledge of concepts utilized in creating musical environments based on heart rate, skin conductance, and EEG brainwaves. We will discuss what bio-guided music therapy is, what measures are used in bio-guided music therapy, what disorders bio-guided music therapy may be applied to, some different approaches used within bio-guided music therapy, including both passive listening and active music improvisation. Why is this important? This approach is relevant to medical music therapy and the trend toward evidence-based treatment. The physiological documentation that accompanies bio-guided music therapy provides tangible records in the language of mainstream medicine that may be useful for doctors, nurses, social workers, and insurance reviewers. Graphs and charts of within-session physiological changes may provide both clinician and patient with valuable insights into what part of the music therapy session had the most impact. Participants will become acquainted with fundamental principles of bio-guided music therapy. Participants will be introduced to physiological measures of heart rate variability, galvanic skin response, blood volume pulse, and EEG brainwaves. Participants will learn basic treatment strategies involving bio-guided music therapy interventions using real-time physiological data in conjunction with sampled music, receptive, or active music improvisation.